Xylitol, I say for mothers, but it's also for caregivers. Xylitol is something new. Actually, it came up about, I'd say about when I was graduating, when I went to the conference. Everybody was like, oh, xylitol, xylitol, xylitol. And I didn't know what it was, but it's kind of pretty mainstay now. Xylitol gum or mints used 4 times a day may prevent transmission of cariogenic bacteria to infants. So if you are a caregiver or a mother, if you're going to chew gum with xylitol, it's actually healthy. And it really cuts down bacterial counts. Next one. So this is how xylitol works. When exposed to xylitol, the bacteria lose their ability to adhere to tooth surfaces. So the bacteria basically, they have to stick to your tooth to cause that cavity. So if you have a lot of xylitol, if you're chewing this gum with xylitol or eating mint with xylitol, what happens is the bacteria gets confused. The bacteria uses the xylitol instead of the sugars. And, bacteria's like, oh, this is kind of nice, let me take this. And once the bacteria uses the xylitol, it becomes weaker, and then it cannot attach to the tooth structure quite as effectively, and so that really helps. Also, it basically the bacteria becomes weaker, and it can't produce acids as much, so it reduces the tooth-destroying acids, and so you've got your plaque on your tooth that's easily brushed and it's easily rinsed from the mouth. These are gums with xylitol. You can actually look at the back, and they should have, this is what you're looking for, xylitol, and that really helps out. Breastfeeding and caries development. Okay, next. I'm asked about this all the time, and I will say the American Academy of Pediatrics and the American Academy of Pediatric Dentistry strongly endorse breastfeeding, okay? It's a natural process. It is absolutely 110% encouraged. And breast milk is, by itself, it's not necessarily cariogenic, like it doesn't necessarily cause as much decay, but it does have some sugars in it. So, next. So breast milk can come in contact with the plaque left on teeth, and it can result in dental decay. So that's something you as parents need to know. So when you're breastfeeding your child, it's basically milk that gets on the teeth, and if it's left there, it's back to that same Venn diagram. If you have food, you have the, sugars, you have time, you have bacteria, you have teeth, you can get your cavity. So infants who breastfeed should have their teeth and gums wiped afterwards in order to avoid the initiation of acid production during sleep. So that is very important. I had a child, a baby, I don't remember how old this baby was, about 2, a lot of cavities. And the mom, I was talking about juices. No, my child doesn't do juices, doesn't eat candy. I'm like, something caused this. And I found out that the baby was feeding at will at night, I think about 8 times in the night. The baby would just wake up, feed, go to sleep, wake up, feed, go to sleep. And it was pretty bad. I mean, I think we have to extract all 4 front teeth in that kid. So it gets pretty bad. So this is what happens. The milk or sugary liquid can pool against the back of your baby's front teeth for several hours while your baby's sleeping. So your baby's got their head up, and you've got the milk, and it just goes on the back of the teeth, and it just sits there. And if you don't wash it off, it's just there pretty much back to that 24 hours. You're giving a good 8 hours right there. And over time, with the bacteria in there, that's what can happen is decay from that. So that's what happens. Cavities can occur on the back of the top front teeth, undetectable to parents. Okay. So the reason I say undetectable to parents is because, if you look, this is the top mouth. Okay, this is a baby. I'm saying this baby's not even 2, because you're looking, this is about the 2-year molar here. We haven't gotten a 2-year molar here. So I'm kind of, because this is not my patients, I don't know. But here is the decay, right here. See how much of that tooth, look at this one, the entire triangle, back is decayed. This one's just slow a little bit. Now this is the back, this is the roof side, this is all the roof of the mouth. So on the outside, where this is the lips and the outside surface, if you really looked at that kid, you wouldn't be able to tell anything's wrong. And so you'll go to your dentist and you'll be like, oh, everything's okay, I don't have any concerns, my baby's fine. And then the dentist will say, well, you got 4 cavities, they're pretty large, and some of these, these 3 for sure, I need to crown them if I need to save them. And you come back home and you tell your husband or whoever, go, oh my God, that dentist doesn't know what she's talking about. Look at these teeth are fine, and she says there are 4 cavities, she wants to put a cap. What's going on? Well, this is what's going on, because sometimes you can't see it, but it's on the back. Dental caries culprits, things that cause dental caries. Juice or diluted juice. The reason I put this slide is mine, because this is a favorite of mine, is diluted juice. Parents come in and they tell me, oh, they only get diluted juice. They don't get the juice. We put half and half. I put half juice and half water. Like that half water is this miracle cure that the child's not going to get cavities. Well, I wish that was true, because that half juice has enough sugar in there to cause all the damage that needs to be caused if it does. So diluted juice is also a no. That can cause cavities. Acidic drinks like sodas, even diet sodas, are bad for teeth. Now, we'll talk about this. I have another slide about how acidic sodas are. One thing about cavities that you need to know, this is for adults as well. Anytime you drink anything anything other than water, sodas, anytime you eat, there's something called a pH, which is the acidity. The acidity in your mouth goes down. Below a certain pH, I'd say below the pH of, I think it's 4.5, you can get a cavity. So you do not want to have an acidic pH in your mouth. So those people who say, well, I'm doing diet sodas because there's no sugar in them, well, think again, because it is acidic and it is creating an atmosphere ripe for getting cavities. Do not allow your toddler to walk with a bottle sippy cup with the above liquids in them. This is what happens. You have a baby, and then when you're around 1.5, you're like, oh, this is great. Now they can have a sippy cup, and then they can just get their drink whenever they want. And this is more convenient as a mother, because you don't have to deal with this. The child gets their drink whenever they want. Well, that's what the problem becomes, is the at-will feeding. You're cutting down the time, and you're increasing the sugars. So your child is constantly getting this, the sugar on their teeth, and the sugar and the plaque on the teeth. The plaque converts the sugar into acids, and pretty soon, guess what? You got a cavity. So not allowing them to walk around, that's a big thing. This, a few years ago, they had what's called the soda generation. When Coke was all big and Pepsi was big, and all the pediatric dentists started seeing the soda generation. Well, I am seeing the fruit snack generation, because you have all these fruit snacks and the labels on them say high in vitamin C, and they make parents feel guilty if you don't buy them, because these labels say this is healthy for your child. It has fruit. It's such a convenient snack, and you as a mother think, oh, this is perfect for my child. But unfortunately, that's the generation I'm seeing right now. A lot of fruit snacks, very sticky, very chewy, very sweet, get stuck in between teeth, and it's doing a lot of damage. So if there's something you can really cut down on, that's something you can cut down on. I pretty much tried to cut down on fruit snacks for my own mouth, because I'm so scared of it. I'm just scared of fruit snacks. It's not the bottle, it's the beverage. I mean, I gave a similar lecture to a speech therapist. And I said, oh, we don't want to use the sippy cup. And then all these speech therapists were really upset with me, because they used the sippy cup as to build pressure in the mouth and all of that. So then I had to explain that it's really not the bottle, it's the beverage in them, which we talked about.